Okay, hi, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment. We're seeing that as expected, you've got a fair amount of arthritis here. We can see there's some areas of full thickness cartilage loss on the medial femoral condyle here. There's an area of full thickness loss on the tibial plateau where it's kind of yellowish. This is part of the meniscus tear on the left that my shaver is working on right there. So overall, this would basically be kind of grade 4 degenerative changes. I'm going to extend the knee a little bit just like that. A lot of this work we can just do with our shaver because it has suction attached to it, but we'll still use basically a small pair of scissors to help us out here. And that's what you'll see coming in next. We've already harvested some bone marrow. We got some really good bone marrow to make a nice bone marrow concentrate injection. So that work has already been done. And now here we're just using this instrument to take away this torn meniscus. It creates a lot of loose pieces, and then we put our suction back in to remove all the loose pieces. Okay, so we'll put our suction back in. Okay, so I think we're done in the medial compartment. We've resected back the meniscus as best we can. You can still see the remaining arthritis. I just want to show you the changes in the cartilage. But at least that meniscal tear is gone. That ought to give you some short-term noticeable improvement. All the loose pieces are gone. Next, we're going to look in the central part of the knee where the cruciate ligaments live. And so we'll go back and get our picture back. There we go there. Okay, and so now that we've removed the ligamentum, we can see the ACL pretty well. We're going to look in this lateral compartment next. But at least we can see the ACL pretty well, and that looks good. The ACL is this strong-looking rope running right up and down here. Okay, so we'll go off on the video. We'll show you the lateral compartment next. Okay, so this is the lateral compartment. The cartilage is in a little bit better shape, but you've still got some radial tearing in the meniscus here. And we're just using our shaver. A lot of times this is all we have to do on the lateral side with this kind of tear. And in just a second here, you'll see our scissors come in. There they are. And we're just going to get this back to a stable rim so nothing catches and tears in the near future here. Okay. Okay, so I think we're done there. You can see there's a little bit of erosion on the cartilage on the lateral femoral condyle there, but not as involved and not as deep or full thickness as the medial side. So we'll keep working here a little bit. The next thing we show you on the video will be the patellofemoral joint. Okay, so now we're looking at the patella up above, and this part of the knee down below is called the trochlea. And you can see you've got some central cartilage loss in the trochlea here. See how this gets really thin? We can track this all the way down to the front of the knee. Right there, that's your anterior cruciate ligament tucking back there. But as we come up along this groove where the patella normally is supposed to glide without any friction or with minimal friction, you can see why that's not happening, because now you've got this rough area where you've lost a fair amount of cartilage. And all these things together are why we're doing this bone marrow concentrate injection, to try and support these areas that are weak and that are breaking down. As we look up at the patella in a little more detail, we can see the medial facet is not too bad. As we look over at the lateral facet, again, there's still cartilage there. It's just getting pretty thin. And the trochlea, you've already lost kind of full thickness. So we'll keep working here. I think we're getting close to being done. We're going to get you back to the recovery room shortly, okay? So this will be the end of the video. Good luck to you now. Bye-bye.